Did you know that North Carolina's Senate Bill 382 goes far beyond just hurricane relief? The 132-page bill not only allocates funds for disaster recovery, but also makes sweeping changes to how elections are run in that state. As a legal nurse consultant, I'm deeply concerned about the broader implications for public health and the integrity of our healthcare system. And here's why it matters. The bill shifts control over the state board of elections from the governor to the state auditor, creating partisan power over how elections are run. Elections determine who sets healthcare policies, funds, public health programs, and make decisions on Medicaid and other essential services. If election oversight becomes more politically driven, the future of healthcare funding and policies could be at risk, potentially favoring certain political agendas at the expense of public health needs. For example, cuts to funding for public health programs could harm vulnerable communities who are already disproportionately affected by healthcare disparities. The change also reduces transparency, risking fairness in how votes are counted and the allocation of resources. The bill itself reduces the amount of time that voters have to correct issues with their mail-in or provisional ballots. For those depending on public services, including healthcare programs, this can make it harder for them to participate in elections. Public trust in the electoral system is already fragile. Changing the rules now could further disenfranchise those who rely on government-funding health programs. This bill also eliminates some very crucial judicial positions, which will slow down the processing of medical malpractice cases and other legal disputes in healthcare. This will affect patients and healthcare providers alike, as longer delays mean more uncertainty and fewer opportunities for justice in healthcare-related cases. So why is this happening now? After the recent election results in that state, which saw a shift in power from Republican to Democrat in the General Assembly, Republican lawmakers are using their supermajority now to push through significant changes to state governance. This bill is a reflection of those efforts, and it's being fast-tracked with the aim of consolidating power at the expense of bipartisan election oversight. For those of us working in healthcare and legal fields now, these changes could deeply affect the way we interact with patients, navigate the legal system, and advocate for healthcare policies. We need to stay informed, speak out, and ensure that health and justice remain the top priorities in our state. So let's raise our voices for fairness, transparency, and the protection of vulnerable populations.